Now's the time to break these chains. Now's the time to pack these things along.
Hey guys, so this is a bit of a different video, and I apologize in advance because it's probably going to be totally not of interest to many of you, in which case go ahead and just click on and hopefully come back. But I did want to talk about it because it's something that that is a part of my life and something I live with, and there's not a lot of information out there about it. So I just want to talk about something that's called essential tremor. And it's a movement disorder that's characterized by, just as the name implies, it's a movement in which when you have, whether it's your arms or your hands or your legs, when you have some sort of movement, it creates that tremor. So if you're at rest and you have the tremor, that can be sometimes indicative of like Parkinson's or something along those lines. Unlike Parkinson's, this is not degenerative. However, there is no cure for it. It's something that can be managed. It is progressive, so throughout your lifetime it can worsen. In my case, it progressed kind of fast. So at the age of about 30, it started in my left hand. It progressed to my arm, and then to my other hand and arm, and then to my legs. It can get to your head and your voice. Fortunately, that's not been my experience, but Katharine Hepburn is an example of someone that had essential tremor and it impacted her voice. So it's something that's pretty pronounced and definitely uncomfortable. And, I got to the point where walking into like a china shop, everybody sort of held their breath, and that's time when you have to do something about it. So yeah, it's a cool party trick, but other than that, it's not cool. So basically, as far as the tremor goes, I'm just going to show you an example. This is the worst side for me. And I'm showing you as far as the movement, because if I don't move and I keep it still, it doesn't have the same effect. So that's what it looks like, in my case anyway. And I've been managing it originally it was medications. I had about 3 years. I tried every combination of medicine out there. And for the most part, they're medicines that they've just sort of stumbled across as a treatment. So there's anti-seizure and things like that. And it really, for me, it took away quality of life, ability to think and concentrate and articulate, and it just wasn't a viable option for me for work. And again, the quality of life wasn't there. So I opted for deep brain stimulation surgery, which is, a scary thing, a big undertaking. But I will say that it was the best thing I could have done, because as you guys may have seen from my other videos, the tremor can be extremely improved and managed as a result of that. And so yeah, it was a series of a couple surgeries, and they go into the brain, they cut down, basically to about there. And so like I have these two skull caps. Actually, I don't know if you could see, there's an area where it's still kind of sort of a bare spot that it really hasn't grown back in. So yeah, it's they put the inserts. There's the wires that come down around the neck and around your neck, and I have the connectors and the wires. I don't know if you can see it, but it's kind of it sort of protrudes right there, and looks like a big blood vessel, which isn't any more attractive than wires, but it's still there. So, and then it comes down and basically into these neurostimulator boxes. And because I have the tremor on both sides of the body, I did have both sides of the brain, and I have the two neurostimulator boxes. So, so I'm talking about this now because yesterday afternoon I realized that in my left side of my body, I was feeling really uncomfortable, and the tremor was coming back. And so I tested the battery pack thing, because there's a little device you can do that, and there was nothing. So the battery died. So and you have to do this like every 5 to 10 years, or 5 years to 7 years maybe, but depending on how much you use it. But so yeah, I have to go back in on, it's either Tuesday or Thursday. We're trying to schedule to have the battery replaced. And so until that time, I'm going to be very twitchy. I'm not going to do like tutorial videos or something like that. I'd have like mascara up here and it just would not be pretty. So yeah, it's going to be, I hope it's not, really distracting for you guys. I'll try and do videos that don't really showcase my hands so much, because yeah, if I'm like showing products, I mean, that hand's not so bad, but I mean, with this hand, it's going to be all over the place. So anyway, and I have had corrective surgeries before. I actually had one of the leads in the brain become like frayed, and so I was having these electrocution effects, which, I mean, literally, it was like my whole body was doing that. Like you just stuck your finger in a light socket. And that was so not sexy. so they had to go back into the brain and completely redo the brain surgery. Good times. And then I had to have it redone again when the wire in this neck broke, and so it broke above the connector. So because of that, they had to redo the whole thing. If it had been below, they could have just redone that portion. So in a nutshell, essential tremor, it is something that can be managed, and for anyone out there that does have it who stumbles across this video, I would say definitely explore the medication options. They may very well work for you, but if it comes to it, I was 30 by the time I had the surgery, about 34, and I had so much life ahead of me, do still have so much life ahead of me, and it's just one of those decisions that it's kind of a no-brainer. Excuse the pun, but yeah, I mean, it just makes sense. Don't be afraid of the surgery. It's scary, but you can get through anything, and at the end of the day, it's amazing the kind of technology and everything that they have and how much control you can get. So anyway, again, thanks for bearing with me. I apologize for the unrelated video and for this, because that's just freaky. And I don't know. Alright guys, so thanks, and tune in another time for a different kind of video. We'll talk to you soon. Bye.